Let's be real, the NCLEX exam can feel like this massive, unclimbable mountain. But what if you had a map? Well, today, we're going to break down the entire prep process into a clear, strategic guide. We're giving you the tools not just to study, but to actually conquer that exam. Okay, so let's just jump right into the one question that is on every single nursing student's mind. What is the absolute best way to prepare? Is there some secret sauce, one perfect resource that guarantees a pass? You see this question everywhere, right? And the truth is, there isn't one. The real key isn't finding some magic bullet. It's about understanding that this whole thing is a climb, and you need to build your own personal path to the top. It's all about your strategy, not just one single tool. So here's our roadmap. First, we're going to frame the challenge itself. Then we'll go straight to the source to build our base camp. After that, we'll put together your study toolkit, learn some killer strategies from people who've already passed, and finally, we'll talk about your final ascent to exam day. Let's do this. First things first, let's just talk about the mountain itself. If you're feeling totally overwhelmed by the sheer scale of the NCLEX, you're not alone. I mean, it's a huge, high-stakes exam, and just admitting that, just acknowledging the challenge, is a really important first step. And here's something you really need to remember. The NCLEX is a full-on marathon. It's not a sprint. Think of it like a rite of passage. Every amazing nurse you admire has stood exactly where you are right now, staring up at this exact same peak. It feels impossible, but it is absolutely doable. Okay, so with that mindset, let's build our base camp. You know, every successful climb starts with solid, smart preparation at the source. And for the NCLEX, that means going directly to the people who actually built the mountain. Your one, and I mean only, official starting point is the National Council of State Boards of Nursing, the NCSBN. These are the people who write the exam. Their website is the single source of truth for everything. The test format, the rules, all of it. Everything else out there is just a third-party interpretation. You have to start here. Now, while you're on their site, you need to find a document called the NCLEX Test Plan. And listen, this isn't just some boring PDF to ignore. This is the literal blueprint for your exam. It tells you exactly what percentage of questions come from each category. For example, it tells you that a huge chunk, about 12% of the exam, is on reduction of risk potential. That means knowing your lab values cold, knowing pre- and post-procedure care, and understanding potential complications like DVTs or wound healing. Studying without reading this document is like trying to build a house with no plans. You just wouldn't do it. All right, with our base camp established, it is time to gear up for the actual climb. This is where we start putting together the tools that are going to get you to the top. And this isn't about buying every single resource out there. It's about choosing the right gear that works for you. A really solid, balanced toolkit should look something like this. And I want you to notice the biggest piece of that pie: question banks. Doing practice questions is, without a doubt, the most important part of your prep. Content review is for patching up weak spots, and videos are awesome for making tricky topics click. But most of your time should be spent doing and reviewing questions. Now, when it comes to QBanks, you'll hear about two main philosophies, and they're kind of perfectly shown by two big resources: UWorld and Archer. UWorld is famous for its ridiculously detailed explanations. You basically use the questions themselves to learn the content. Archer, on the other hand, is known for making its questions intentionally a bit vague to better copy the feel of the real NCLEX. So you can think of one as a learning tool and the other as more of an assessment tool. The best one? It's the one that matches how you learn. And for those times when you're reading a textbook and a concept just is not clicking, video is your best friend. Channels like Simple Nursing, Registered Nurse RN, and Level Up RN are huge favorites in the nursing community. They just have a knack for breaking down really tough topics with great visuals and memory tricks. And of course, you have the legendary Mark Klemek lectures, which are basically a rite of passage all on their own. Okay, we have the tools now, but how do we actually use them in the most effective way? Well, for that, let's turn to the wisdom of the people who have already made the climb. These are strategies pulled directly from successful test takers on forums like Reddit's r/PassNCLEX. This piece of advice right here is pure gold. Consistency over intensity. You know, trying to cram for 7 or 8 hours on a Sunday is way less effective than doing one solid, focused hour every single day. It's all about building that mental stamina you're going to need for the marathon that is the NCLEX. And that idea of consistency leads right into this daily habit, which is what you see top passers do over and over. It's a simple loop. Step 1, do a block of questions. Step 2, review every single rational. not just the ones you got wrong. Review the ones you got right to make sure you knew why you were right. 3. Make some quick notes on your weak areas. And 4. Wake up and do it all again tomorrow. This loop is your training.
Here is another game-changing piece of wisdom. The NCLEX is not a test of memorization. It is a test of your judgment and your critical thinking. You absolutely have to understand the why behind what you're doing. Why is a certain lab value the top priority? What's the first thing you do for a patient with a suspected DVT? Why does the patient with a post-op ileus need an NG tube for suction? That's what the exam is really trying to figure out.
So, you've put in the hours, you've followed the plan, you've been consistent, and now the summit is finally in sight. This last part is all about bringing everything together and making sure you approach exam day with confidence. Let's just do a quick recap of the entire path to success. You start with the official blueprint from the NCSBN. You pick a QBank that actually matches your learning style. You use videos to help with the really tough concepts. You build a consistent daily study habit that's all about reviewing rationales. And maybe most importantly, you learn to trust your clinical judgment. That's the path.
The big takeaway here is that you're not starting from scratch anymore. You have the map, you have the right tools, and you have the strategies that have worked for thousands of nurses before you. You are prepared for this climb.
And that brings us to the end. You've seen the path laid out. Do you know what the tools are? So I'm just going to leave you with this question to get you started. What is the very first tangible step that you are going to take today to begin your ascent?